Welcome back. Thank you very much for staying with us. Now, a survey by the Medical Protection Society has found that approximately 72% of doctors experience mental health challenges. The Medical Protection Society maintains that government, private hospitals and medical societies all have a part to play in improving mental health awareness and support. Joining us to discuss this further is Dr Siki Gwanya-Mdletye, a specialist psychiatrist. Good evening, Doctor. Thank you very much for joining us on the program. Very concerning figures. What are the mental health challenges, or at least what can this be attributed to?
Good evening, Pundo, and thank you for having me. There are a vast array of challenges that doctors face within their workplaces. A lot of them are systemic. A lot of them have to do with the conditions under which doctors work. So, doctors tend to, especially doctors who work in the public sector, but including doctors who work in the private sector, tend to face quite a high workload. As we know, in South Africa, the ratio of the population to the number of doctors, it's a scarce skill. So this means that doctors tend to have a high workload, tend to work under very pressured conditions, high time pressure, and yet having to make very critical decisions that can affect the quality of life of their patients, and decisions that can indeed be even life or death decisions. Mm-hmm. So having to make those very important, very critical decisions in conditions of time pressure, in conditions of feeling, that these decisions have to be made in close succession because of the workload, very little recovery time in between those. So these are some of the conditions that may contribute to this.
But doctor, given the nature of their work, many would assume that there would be avenues for that almost play as some sort of an outlet, that there would be wellness institutions that assist doctors. So where's the gap exactly when you're finding such a high number of doctors are struggling with mental health issues?
Yeah. So I think perhaps you're asking who is caring for the carer.
Yes.
Because ultimately, this is one of the hugest gaps we have when it comes to the care of the mental health of medical practitioners. In terms of occupational health services and employee wellness services, we do know that the public of DPSA is the biggest employer of government employees, and most doctors who work in the public sector work in DPSA. Doctors in private, that's not the case. We don't really have well-structured interventions that are geared at the support of the mental health of doctors.
In what sense?
And I must say it's not completely so. In the sense that, so for instance, with employee wellness services, right? These are beginning now to actually become commonplace in terms of people that work within the Department of Health. Have not always been the case, and in a lot of the smaller cities and a lot of the smaller hospitals are still not actually that commonly used. Access to the services, even when they are available, is a bit of a challenge. When we talk stigma, we sometimes think that it's only outside of the medical fraternity. It's big in the medical fraternity, and accessing mental health services requires one to overcome the different layers of stigma that prevent one from accessing help. Bearing in mind that when one accesses employee assistance program and becomes vulnerable about their mental health struggles, the perception that one's ability to practice may be compromised by their disclosures to the employer, that perception is real, and the sense that if I become too vulnerable, I may give the impression that I'm an impaired practitioner and therefore cannot continue to practice as a medical practitioner. You can imagine then that this would deter one from accessing help even when help is available, right?
That's honestly very worrying, because many would assume again that this would be a private conversation where one then can openly be that vulnerable. But the real problem here, doctor, is that when we look at this data, the poor mental health of medical practitioners can also compromise patient care.
That's so true, right? When you think about the whole construct of burnout, and there's a lot of discussion around whether it's a formal diagnosis, whether it's an occupational manifestation of depression. But when you think about the construct of burnout, right, we think of burnout in terms of three main domains, right? In terms of emotional exhaustion, right? So just the sheer exhaustion and feeling that I've cared too much, too long, and quite frankly, I'm tired of caring. That emotional exhaustion, you can imagine, affects empathy, and empathy is a very important tool when we are talking caring for a patient. Another domain is that of cynicism and just kind of losing touch with that empathic side and becoming a lot more cynical, a lot more, you can say, blasé, because of the fact that you are facing these big decisions every day. They kind of become matter-of-factly. And this can come across as someone who is callous, someone who, a doctor who's unaffected by the pain of the patient they are treating, and who comes across as being quite careless. So, doctor, pardon me for interjecting there, but just in the interest of time, what needs to happen then? How can government and even the private sector or even medical societies assist? Yeah, I think it's important what you said in your introduction, Fondo, because this is a system issue, right? Interventions that are geared or directed at individuals, I feel, are very superficial, because you cannot say to one, become resilient and you'll be okay, when the challenge is system-wide, right? So in terms of the system, it's important that employers of medical doctors and medical doctors who work in private are mindful of how much time am I spending at work, how much overtime am I putting in, how much rest am I getting. So those are the important self-care measures that one can apply themselves. But the system then needs to adapt to making the working conditions more favorable, to upstaffing, which we know is not that easy, is not an easy solution, because it takes a long time to train doctors. How do we then address the short staff conditions? How to address the working hours conditions? How does the system actually make the places in which the doctors work favorable for their mental health? If you look at the conditions of the hospitals, you look at, so by the time a patient gets to see the doctor, they've been through this, hospital or clinic that is, difficult to navigate, and where the conditions are not that great. I don't need to talk much about that because we've seen those. So what I'm saying is, when the system challenges that make working difficult for doctors are addressed, this can become a step in the right direction in terms of helping doctors to take care of their mental health.
And then I think also just pardon me there, I suppose it is a very important point that you make, that here it needs to be a multi-pronged approach, that you're not dealing with just the mental well-being of the doctor, but the system, because once they are okay, they'll still come back to a very dysfunctional system that will overwork them again, where they'll be exhausted and then depressed yet again. Correct.
That's correct.
Doctor, thank you very much for your time this evening, though unfortunately we have run out of time. Very interesting conversation. That's Dr. Siki Gwanya-Mdletye. She's a specialist psychiatrist speaking to us there.